Welcome to this lecture video presented by Devoted Care Services, LLC. Today we'll explore the critical topic of recognizing stroke signs. Strokes are medical emergencies that require immediate action, and as caregivers, understanding the signs and knowing what to do can save lives. This presentation will provide you with clear and practical knowledge that you can use in real-life situations. Let's begin. Let's start by understanding what a stroke is. A stroke happens when the blood supply to part of the brain is cut off, depriving brain cells of oxygen and nutrients. When this happens, brain cells can begin to die within minutes, so immediate medical attention is essential. There are three main types of strokes. The first is ischemic stroke, which is the most common type. It's caused by a blood clot or blockage in a blood vessel that supplies the brain. The second type is hemorrhagic stroke, which occurs when a blood vessel in the brain bursts, leading to bleeding. Lastly, there is the transient ischemic attack, or TIA, often referred to as a mini-stroke. TIAs are temporary blockages, and while they don't cause permanent damage, they are serious warning signs of future strokes. Now let's discuss the causes of stroke. Strokes are primarily caused by issues in the blood vessels that supply the brain. In an ischemic stroke, a blood clot or other obstruction blocks the flow of blood. In a hemorrhagic stroke, a blood vessel bursts, causing bleeding in or around the brain. There are several contributing factors to these conditions. High blood pressure is a leading cause because it puts extra strain on blood vessels. High cholesterol can lead to the buildup of fatty deposits in the arteries, narrowing them and increasing the risk of blockages. Heart disease, including conditions like atrial fibrillation, can also lead to blood clots that may travel to the brain. Understanding these causes helps us better manage and reduce the risk of strokes. Recognizing the signs of a stroke early can save lives, and the acronym FAST is a simple and effective way to remember the key symptoms. F stands for face drooping. If you suspect someone is having a stroke, ask them to smile. Does one side of their face droop or feel numb? A stands for arm weakness. Ask the person to raise both arms. Does one arm drift downward, or is it difficult for them to lift one arm? S is for speech difficulty. Listen closely. Is their speech slurred, or are they having trouble finding or forming words? T reminds us that time is critical. If you notice any of these signs, even if they go away, call 911 immediately. Acting quickly can make all the difference. Let's talk about stroke risk factors. Some of these are non-modifiable, meaning they're out of our control. For example, age is a major factor. The risk of stroke increases as we age, particularly after the age of 55. A family history of stroke also raises your risk, as does gender. Women, due to factors like pregnancy, birth control use, and hormonal changes after menopause, face a slightly higher risk than men. However, many risk factors are modifiable, meaning we can take steps to reduce them. Smoking is one of the biggest contributors because it damages blood vessels and increases the likelihood of blood clots. Uncontrolled high blood pressure is another significant factor, as it strains blood vessels over time. Diabetes, if not managed properly, can damage blood vessels and nerves, increasing the risk of a stroke. Lack of physical activity and poor dietary choices, such as consuming too much salt, sugar, or unhealthy fats, can lead to obesity, high cholesterol, and other conditions that elevate stroke risk. By focusing on a healthy lifestyle, we can significantly lower the chances of a stroke. What should you do if you suspect someone is having a stroke? The first step is to act fast and call 911 immediately. Emergency responders are trained to handle strokes and can begin life-saving treatment right away. If possible, note the time when the symptoms first appeared. This information is critical for doctors as it helps them determine the most appropriate treatment. For example, some treatments are only effective if given within a specific time frame. Additionally, avoid giving the person any food, drinks, or medications unless directed by medical professionals, as these could complicate the situation. Remember, every second counts during a stroke emergency. Let's wrap up with some prevention tips. Prevention is one of the best strategies to combat stroke. Start by maintaining a healthy lifestyle. This includes eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Regular exercise, even just a brisk walk for 30 minutes a day, can have a profound impact on your overall health. It's also important to avoid smoking, as it significantly increases stroke risk. Limiting alcohol consumption can also help prevent conditions that lead to strokes, such as high blood pressure. For those with chronic conditions like high blood pressure, diabetes, or high cholesterol, regular checkups and proper management are key. Follow your healthcare provider's recommendations for medications, diet, and lifestyle adjustments to keep these conditions under control. Thank you for taking the time to learn about recognizing stroke signs with us today. By staying informed and proactive, we can make a significant difference in the lives of those we care for. As caregivers, your dedication and knowledge are vital to improving outcomes and providing exceptional care. For additional resources or assistance, please reach out to us. Thank you and happy caregiving.